So the image guided radiotherapy, which is different from the intensity modulated radiation therapy. Here this is an existing idea only, but here what we do is, as the name indicates, image guided, we will be keep on taking the feedback of the treatment through MRI, CT or ultrasound. Okay, so which means that the image read, okay, the MRI, ultrasound or CT scan will be taken as a feedback, and based on the feedback the treatment will be progressed. Okay, so that is what the imaging is done frequently. So and the position of the beam, okay, the position of the beam is altered, and that is done even if the beam is in on condition. Okay, so the real-time corrections can be made based on the feedback obtained from the images. Okay, so by which the margins can be reduced. Okay, so in the previous cases in IMRT and CRT etc., we don't take images regularly. Okay, there is not frequent imaging is taken. Okay, so in image guided, as the name indicates, image guided, we will be frequently reading the information about the tumor treatment through the image, and accordingly the treatment progresses. Okay, that is the meaning we need a image guided RT. Why we need a image guided radiation therapy? So that we can able to understand the organ variability during the treatment. Okay, so here the first diagram, which shows the prostate cancer enlarged. After a week we can find that the prostate cancer has been reduced. Okay, a CT scan after a week later. And another important thing is about this treatment is the plan of treatment is done frequently by the CT scan taken. Okay, so this increasing treatments with higher conformality requires better targeting. Okay, the first thing. The next is the improved image guidance allows for more conformal treatment delivery. Okay, then third one is the improved imaging allows for better tumor delineation for radiotherapy planning. So when I have a prostate cancer here, the shape and size of the tumor, like what we have discussed in IMRT, those things will be taken, the images, and the images will be converted into 3D, and the dose distribution is done and the beam will be provided. In image guided RT, based on the imaging result, accordingly the dose distribution and the intensity of the beam is changed. Okay, so the conformality increases based on the imaging which we have obtained frequently. That is what improved image guidance. Okay, so we will be taking the image, and the image will guide us the treatment process in the forward direction. Okay, so as I said, we were converting a 2D into 3D or 4D. 4D means I will show you an example, and IMRT and IGRT. In all this process, we can find that the 2D images for a neck cancer that has been 2D is converted into a 3D image. 4D image is about the motion. The fourth dimension is nothing but the motion. So we take a 2D image and combine the 2D image into a 3D image. Now the 3D image, 3D data will be moving. Okay, so when the 3D data is moving, the movement is considered as the fourth dimension. Okay. The common IGRT technologies. Okay, some of the, you can see that the machine is drawn here. You can find that the gantry will be moving around the patient, and this is the O-ring. Okay, O-ring rotation of that one. The patient will be at the center. Okay, so we have the different types. The first one is the 2D projection X-ray. The next one is the CT scan. Third one is ultrasound. fourth one is surface imaging, and the fifth one is the implanted marker. So as we say that the image guided radiation therapy, so it's about I acquire an image, see the status of the tumor, accordingly the radiation therapy will be provided. Okay, so there will be fiducial markings. Markings means around the image we have, you can see that the hand drawn structure diagrams are here. Okay, so we can have a the name is fiducial marks, or we can have an implanted marker inside the patient body where the tumor is there. Okay, through that we can able to find out the status of the treatment. Okay, so this is the X-ray type. The first one, 2D projection X-ray. That is the X-ray is projected on the patient on 2 dimension, both X and Y directional. We will be doing it. Okay, that is the first one. The Novalis Exact Track, that is a real-time device which is used for this. Next is the CT. Okay, the CT on rails. Okay, you can see that we have the same CT reader and we have the LINAC. You can see the image. In the left hand side you can find that the CT on rail, and the right hand side we have the LINACs. That is what it's called as IGRT. Okay, so the left hand side we have the CT image, and the right hand side we have the linear accelerator. Okay, so the linear accelerator will providing the radiation beam on the patient, the yellow line. Okay, the yellow line drawn in the one is the 3-dimensional axis is drawn. The nearby we can find that a dotted one and a arrow mark is drawn. Okay, that is for the rotation. Now the patient will be rotated, and for the CT imaging, and the LINACs gantry will rotate around the patient for the radiation treatment. Okay, for the intensity beam falling on the patient, LINACs will be used, while the CT on rails will be taken. Okay, that is what the name image guided. Okay,